My vision for personalized healthcare is a health system in which patients are receiving earlier and more accurate diagnosis. They're receiving more certainty in treatment, and they're working with their physicians in terms of treatment decision making in a way that is right for them. They're having speedy access to therapies, and they have access to digital tools and technology that will help manage and monitor the life cycle of them as a patient. This future is only achievable if we are accessing and sharing data among all stakeholders in a health system, from the patients to the providers to the private sector to the regulators to the governments. The data has to be high quality, it has to be interoperable, and it really has to be in service to the greater good, to an improved healthcare system. Stakeholders around the world are acknowledging that personalized healthcare is the future of the health system. This is an inevitability, and many stakeholders have that belief. Governments in particular, national governments, have the opportunity and the mandate to help compel this willingness to move from today's healthcare system to a future healthcare system. And we see many governments actively doing this. In APAC, Korea and Taiwan are actively seeking to be leaders in precision medicine, specifically because they believe it will spur economic growth. In India, we see the government acknowledging that digital health and personalized healthcare is a means to achieving universal health coverage for their millions of citizens. And other places around the world are acknowledging that data infrastructure has to be integrated in order to bring the best care to treatment. In Europe, 22 European countries have signed on to the 1 Million Genome Project, where they're committing to making their genomic databases interoperable in service to improving treatment for patients. So we see this willingness around the world. I think there are still some gaps in terms of readiness around the world. There's still quite a bit of education that needs to happen for various stakeholders in terms of data policy, making sure the right data infrastructure, quality, and sharing is in place. In terms of regulatory policy, we need to make sure that regulators are valuing and utilizing real-world evidence in their decision-making process. In terms of access policy, we need to make sure, likewise, that HTA authorities and payers and budget holders are valuing real-world evidence in their decision-making process. And it's only with these structural changes in the health system that we're going to be able to achieve that future. We need to convince all stakeholders to take action to achieve the personalized healthcare future. We need stakeholders to take action around data policy, around regulatory policy, around access policy, and the decision makers in that ecosystem, in those regulatory and payer ecosystems, are stakeholders who are compelled by evidence. So we have to uncover the compelling evidence that will convince stakeholders to take action. And where that evidence doesn't yet exist, and it doesn't in many cases, we need to develop that evidence. I know that private sector, which I represent, is working hard to bring stakeholders together and to catalyze localized pilot projects, working with governments, with hospitals, with various stakeholders to put in place end-to-end PHC solutions, genomic profiling, matched treatment based on that profiling, using real-world evidence generated from that profiling to optimize treatment decision-making. We're looking to put those solutions in place in localized settings in order to generate the evidence that will convince other stakeholders to adopt these pathways and to replicate and scale these solutions around the world.